This party started. Good afternoon. I'd like to call this meeting to order, although we have been meeting just not. Why? Why? Yeah. Okay. Anyway, today is Monday, Thursday. Girl, today is Thursday. Yeah. Okay. Today is Thursday, September 25th, 2025. The time is 11:38 a.m. This is an additional meeting of the Committee on Health. We're holding this in room 123 of the John A. Wilson Building. I'm at-large Councilmember Christina Henderson. I'm chair of the committee. We've been joined by three colleagues, Councilmember Charles Allen from Ward 6, Councilmember Brianna Doe from Ward 1, and Councilmember Zachary Parker from Ward 5, and we have a quorum. Today, we're going to vote and consider one measure, which is a nomination to the Health Benefit Exchange Authority Executive Board. PR 26-240 nominates Dr. LaQuandra Nesbitt to the Health Benefit Exchange Authority Executive Board as a voting member, filling a vacant seat formerly held by Ramon Richards for a term. Remaining term to end on July 6, 2028. The executive board governs the Health Benefit Exchange Authority, which oversees the district's insurance exchange under the Affordable Care Act to expand consumer choice and affordability in healthcare plans. The board is comprised of 7 voting members who are district residents appointed by the mayor for 4-year terms and 4 non-voting ex officio members. Voting members must demonstrate expertise in at least 2 areas, including such as healthcare coverage, plan administration, finance, delivery systems, insurance management, actuarial analysis, healthcare economics, human services, consumer advocacy, public health programs, or enrollment into health plans. Dr. Nesbitt is a board certified family physician with extensive experience in population health leadership. She has served as the director of DC Health from 2015 to 2022, where she oversaw major public health initiatives for 4 years before leading the district's COVID-19 response. She also served as the interim director of the Department of Behavioral Health. In this capacity, she served as an ex officio member as the health of the Health Benefit Exchange Authority Board, giving her direct experience with the governance and operations of the exchange. Prior to her service in the district, she directed the Louisville Metro Department of Public Health and Wellness, where she led initiatives focused on implementation of the Affordable Care Act as well as violence prevention. She's currently the Senior Associate Dean for Population Health Sciences and Health Equity and the Bicentennial Endowed Professor of Medicine and Health Sciences at George Washington University, where she also directs the Center for Population Health Sciences and Health Equity. She has served on several advisory boards for the CDC as well as the Commonwealth Fund, and Dr. Nesbitt earned her MPH from Harvard and her MD from Wayne State University. She is currently a Ward 4 resident. During the roundtable, we discussed Dr. Nesbitt's approach to serving on the board, drawing from her prior experience as an ex officio member. The conversation highlighted her passion for advancing health equity and her emphasis on outreach and education to ensure that all district residents, particularly those who are in underserved communities, have access to coverage. We spoke about the importance of innovative strategies to improve health literacy, the value of interagency collaboration, and the role of community partnerships in achieving equity. Dr. Nesbitt conveyed a strong commitment to public service and expressed a desire to bring this dedication and perspective to her work on the board. I'll now open up the floor for anyone who has any comments. Councilmember Parker.
Thank you. I would just say Dr. Nesbitt has given so much to the district, and I was excited when I saw this nomination. I know she has served as an ex officio member, and it's great that she will be able to use her expertise and perspective to be a voting member. And so I look forward to supporting this nomination. Thank you.
Thank you, Councilmember Parker. Yes, I did tell Dr. Nesbitt I was surprised to see her returning back to public service, but she does feel like it is time. So, and we're happy to have her expertise on that. All right. I'll move the draft reports in print of PR 26-240 in block with leave for staff to make any technical changes. All in favor, please say aye.
Aye.
Let the record reflect that the ayes have it and the measures pass unanimously. I just want to note we were planning to mark up another nomination, and I just want to take the moment to clarify on the record. So the health professional licensing boards are not what I would consider a traditional community advisory type role. These professional boards, licensing boards, are dealing with the scopes of practice, the approval of licenses, the denial of license applications, as well as disciplinary complaints that may come up dealing with a particular profession. And for a consumer member of these boards, although the statute says that their only requirement is that they are a district resident, we have had a track record of having consumer members who have some type of lived experience dealing with a particular profession, for which they are seeking to serve on that board, or some type of professional experience with that profession. And we want to hold true to that, given that these are licensing boards that are dealing with, again, the professional licensing of our healthcare workforce. So take that for what it is. All right. This does conclude today's meeting. The next meeting the committee will hold is on Tuesday, September 30th. We're going to hear from various stakeholders as we examine the operations, service delivery, and accountability for the district's managed care organizations that administer our Medicaid benefits. It's an important oversight hearing, and hopefully colleagues will join for that conversation. We spend hundreds of millions of dollars on our Medicaid programs, and so we want to make sure that we're getting our true value on behalf of district residents. With no further business before the committee, the time is 11:44 a.m. and this meeting